Hi everyone, this is Dr. Pepe. We are doing 5-minute videos for the National Counselor Examination Reviews, and we are under Domain 2, Intake Assessment and Diagnosis. And today we are going to cover sub P, assessing substance use. So with substance use, or you may hear substance abuse, it's important to understand the extent of not just the extent, but also the nature of the abuse or use and how that is impacting daily functioning or general functioning, kind of like we talked in previous videos about the GAF. And the reason why that is important is because that is going to be your baseline for appropriate diagnosing. It's also going to lead you into treatment planning. It's also going to lead you into goal settings. So the first piece, and this is usually done in the intake phase, is to determine what does that drug use or abuse looks like. And that is done with different modalities. You may be familiar with standardized screening and assessment instruments. Also, there's standardized interview protocols, and as well as different types of urine or blood test in order to do a medical analysis in order to get very specific as to what that use or abuse looks like. So be mindful of the screening that is usually done to evaluate the presence of the problem, and to determine, level of functioning, and also the assessment piece. And again, these are usually standardized assessments that define the nature of the problem. They also help you determine the diagnosis, whether it's in the ICD or the DSM. And they also many times they based on the score or the severity, they help you look at treatment recommendations in order to address the diagnosis, as well as the goals for the client. With any type of screener, it's important to look at different multicultural factors in order to determine the appropriateness of the screener. Also keep in mind that an assessment, really any assessment, whether it's a substance use or abuse assessment, it's just one tool, and it can only provide you one data point. But with any screener, you want it to be as comprehensive as you can. Some common screeners for substance abuse or use that you may want to be familiarize yourself with is the alcohol use disorder identification test, or audit. Another screener that is or has been common is Texas Christian University Drug Screener, or TCUDS. Another screener is the CAGE, and again, all of those can add different types of information as far as severity, or as far as how long the abuse has been going on. So you want to be mindful of of what type of screener and is it appropriate for the specific client and population that you're working with.